Welcome back. When it comes to healthcare, you want to make sure you find a practice that is a good fit for you. And our sponsors at Farewell Medical Practice are dedicated to treating their patients with a focus on lifestyle over prescriptions. I'm joined now by Dr. Alicia and Megan. Hi, ladies. Thanks for coming in.
Hi, so nice to meet you.
Thank you for having us.
I want you to start off by talking about Farewell Medical and how it got started.
So Farewell Medical was always a vision that I had. Even in training, I always had this idea that we should have an ability to not have to find different types of approaches of care. Everything should just be in one place. And so I wanted to have a primary care practice that also offered different services, different options that patients didn't have to search for.
I like that. Now, you focus on lifestyle medicine. Can you talk about what that means?
Lifestyle medicine is just focusing on 6 pillars of health. So that talks a lot about what we eat, how much we move, how well we're sleeping, what is our stress, and what does our management technique looks like, as well as social support and connection. So all of those, including as well avoiding risky substances. We also take another take on that as how can we also avoid using medications first and using those lifestyle approaches to keep you healthy.
Now, you guys have classes and courses that you offer your patients. Do you want to talk about them and why you chose them?
So a lot of the classes that we chose are simply because they're things that I fell into while I was in training. We offer meditation, yoga classes for our patients weekly. We also offer chair yoga, so everyone sits in a chair while they're doing yoga classes.
My grandma does that. She loves it.
It's wonderful. I've learned a lot actually by doing it myself too. We also offer culinary medicine, which is a combination of nutrition which meets culinary skills. We always laugh that we're not chefs by any means, but the curriculum was created by the American College of Lifestyle Medicine and incorporates different recipes that are curated by dietitians, as well as physicians, as well as chefs. And it's kind of like coming to, your grandma's kitchen. And, we all just divide up the tasks and cook together, and then we get to share a meal at the end of the day.
Yeah, there's nothing like community and togetherness. What better way than with food, right?
Yeah.
Now tell us about your team.
So there's myself, I'm the owner, and then also the sole medical provider. And we have Megan Bishop, who is our practice manager.
Yes. We also have a registered nurse. Her name is Carolyn. And then we have Nikki, who is our office assistant and kind of the catch-all of everything. She's remote with us. She's down in Florida, but we all try to keep a close-knit team. Because there's only 4 of us, it really allows us to have this very beautiful mix of when a patient walks in, we could be like, "Hi, Diane, how are you?" They feel like they're at home. A lot of people get nervous when they go to the doctor.
Yes.
So we want to create more of a better, positive, more zenful atmosphere. Something else about the team that's really great is Dr. Lal here has allowed us some flexibility with our days. We want to practice what we preach. So that means that, I get to take a break for 30 minutes to an hour and go outside, take a walk. My dog Birdie comes with me to work every day. The patients love her, so that gets her out and about. So yeah, we have a really nice, flexible environment that we can come to every day.
Which is important, right? A lot of people are, like we said, nervous to go to the doctor, and then they're not taking care of themselves just because they have so much anxiety about it. But if you're cultivating a space that feels welcoming and warm and not so scary and not so medical, we'll say, that, it encourages more people to then take care of themselves. Now, you decided to transition from traditional primary care to a lifestyle medicine focus. Why was that so important for you?
Kind of goes back to what Megan was mentioning. I mean, at a certain point, if you're advising and encouraging somebody to eat well and sleep better and take care of themselves, you can't really promote those things unless you're doing it for yourself. And over the last few years, just noticing how the medical world has changed a lot, and providers and patients aren't just able to have that connection anymore and that relationship. So to me, this was kind of the perfect way to create a space that doesn't feel uncomfortable and doesn't it's just something that I think we all want to create together, and we've really built that community piece with our practice. I mean, we laugh that sometimes people will stroll in, they need to grab something to drink because they're running errands, and we want that environment. We want them to be able just to stop in when they feel comfortable.
And to do that, you have a membership-based model, right? Can you explain to us how that works?
So we still provide traditional primary care services, and we use medical insurance for those things. The membership is more for the non-covered services. So the yoga classes, the culinary classes. We also are part of a national nonprofit called Walk with the Doc, and that's actually open to the entire community. And we also do social events and anything that a patient is interested in. For example, we've been doing a writing group the last few months. So if somebody brings up something to us that they're really interested in doing, we want to create that space for them. So the membership is really just giving them that opportunity to take part of all those classes and courses.
Alrighty, thank you both so much for coming in and sharing more. And viewers, you can visit our sponsors at Farewell Medical Practice by visiting their West Seneca location or their website at farewellhealth.com. Thanks again for coming in, you two.
Yeah, thank you.